South Africa's advanced medical facilities and world-class tourist destinations makes it a sought-after destination on the continent. But the pandemic has presented a slew of challenges for the sector. Those affected include emergency medical evacuations companies. These service providers often connect patients to local medical professionals and private hospitals for medical treatments. The shortage of beds in hospitals has also posed further challenges, with less urgent cases having to be rescheduled.
Patients coming in for less urgent procedures, we just had to move those out. So it's just really been more of an administrative issue of moving out. Yes, we haven't had the same volume as we would have had 2 years ago. But yeah, it's the nature of what it is. But it's not only us that have been affected in the tourism sector, it's also been the health sector. You know, those involved in the emergency aspect of COVID have been fine, and some of the medical specialists have had to volunteer to go and work in COVID wards.
Difficulties with the cross-border movement of patients into South Africa continues to be a challenge.
It is currently increasingly difficult to move any patients into South Africa. Both South African nationals who are living abroad who need to come into South Africa for care, as well as other patients. Finding hospitals and ICU beds is every day an absolute fight. It's extremely difficult, and it's continuing to be difficult. There are major issues in terms of normal ward beds, ICU beds, high care beds, you name it. The hospital systems are stretched, their doctors are overworked, their nursing staff are absolutely exhausted.
Most of the patients moving into the country for medical treatment mainly come from the SADC region. Industry experts say the demand for care in South Africa has skyrocketed since the outbreak of the pandemic, driven largely by the poor health facilities in other African countries. Turas Sefako Mosi, SABC News, Johannesburg.